actually show me where you're feeling the pain?
So, you know, I feel it in here.
Oh, it's a lot harder up than that. Okay.
Yeah. And then, I mean, I do have like lower back too. And then it's just really always in here. It's like where I really feel the most like tightness.
It's not on one side more than the other side?
Well, this side typically feels tighter.
Right side?
And
okay.
yeah.
And it goes all the way up to here?
All the way up, yeah.
The pain that was wrapping around, that wasn't here, right? That was over here?
Well, no, it just feels like tight in here.
And then
I always kind of feel something here too, like it always like hurts right in here.
underneath the shoulder blade? Okay. So off the bat, I already see there's some swelling over here, especially over here. The 20 years that you've had of pain, is that the one that here or more?
No, it's just been in my neck and my shoulders. Like the lower and mid is very recent, within the last year or so, I would say.
Got it. Okay.
Yeah. So it's always felt just like my neck and my shoulders. I never, for really a long time, never had any mid or lower back pain. That's very recent.
Oh, okay.
Yeah.
So the thing that's getting you kind of affecting your mood, that's over here again? Okay. And then you said you can't sleep. You have to take Xanax for that? That's actually the thing that's bothering you?
Yeah, well, to get comfortable at night, to like sleep through the night. You know what I mean? Like I wake up because it hurts, or I'm not comfortable. So like I'll just feel very like tight in here, and I just can't seem to get like comfortable enough to sleep through the night. Actually, it like hurts sometimes. Like, you know, like I can't find the right pillow, or you know, like it's not even comfortable to lay down. You know how most people lay down?
Yeah, yeah.
And they're like, oh, yeah, that's not me.
So does it wake you up then? If
Yeah.
You don't? Okay. Got it.
And I can't get comfortable. I'm never comfortable when I'm laying down.
Got it. Okay. So this is the thing that's been progressively getting worse over the past 20 years.
Well, the sharp pain's kind of in here.
Okay.
Like and it's just like little. It's not constant. It'll be like, you know, if I move, like I'll feel like a little sharp pain, or like or I'll feel it like it feels like sometimes it's in my chest, or sometimes it's over here.
Got it. Okay.
Just depending on like movement.
So the bottom of the rib cage, like over here, does it kind of wrap to the bottom?
Yes,
of the rib cage?
absolutely.
Got it.
Yeah.
Got it. Nobody's ever told you you have an L6, huh?
No. Today.
Your neck pain that you're feeling back there, when you tilt your chin up, does that actually hurt your...
Yeah, it feels sore in the back.
Where?
Whenever I lift my head up.
When you lift your head up?
Yeah, it feels like sore in here.
All through here? More here or more here?
Or right here.
Got it. Got something going on over here. Okay. So like I said, that 6 lumbar makes you have like a really large like curvature over here.
Yes.
And so that does impact what we're going to be doing over here on the upper part.
Right.
But typically when people have a larger arch down here, typically it kind of translates all the way up, but it doesn't really do that for you. So basically all the bones should like open up in the back, right? As you put your head down.
All right.
A lot of them are.
Yeah.
But this one down here is not, right?
Right.
And then even when you come back, each joint should actually close down. But you see how this one's not closing down on that one? Is that painful right here? Not too bad?
Yeah, a little bit.
A little bit. Okay, that's your T12. So, tender right here? Yeah. So, what I'm feeling for is swelling. Even looking at you, like I was saying before, even without touching your spine, I can see there's basically a ball of fluid right here. So something's really swollen over here. It's pretty chronic into there.
Yeah.
And then so when I feel it actually dips in right here.
Yeah.
Is that tender right here?
Yeah. Well, that's where it hurts.
Yeah.
Like that's where it feels like there's a giant knot.
Okay, so just relax your right shoulder a little bit more. Have a longer neck. Good.
So it actually feels much looser on this side.
Good.
Right. Yeah.
We'll adjust kind of the sides right here. So just relax your belly. This is your T6, and just relax your belly. Keep going down. Good. So this is your T12. So this is the transition between your thoracics and your lumbars. Okay, so This one is the one that radiates to the bottom of your rib cage.
Okay.
So I'm going to adjust this one. So I'm going to have you just relax. Okay. Just relax your shoulders down a little bit. Good. You've never gotten that adjusted?
No, not right in here. Like lower.
Yeah,
Right.
so traditionally it's actually missed a lot.
Yeah, it does feel a little looser in here now.
Okay.
Yeah, I do kind of do this.
Yeah.
Like, yeah.
Yeah.
Is that normal?
No. So
Oh.
it's actually what's called a sway back.
Okay.
So basically we can see that it's really steep into here.
Uh-huh.
Typically what that means is there's something wrong over here.
Okay.
So you have an L6, which you're going to have a larger one over here anyway, larger lumbar curve, but this is pretty steep
That's
into
because
here.
of my extra bone?
The extra lumbar curve is from that,
Yeah.
but the sway back is not because of that,
Okay.
right? So I'd argue that this
Yeah.
is actually causing problems all the way up into here
Really?
too. Yeah. So that's a little bit tender,
Yeah,
right?
that kind of hurts.
Okay. But this one's not too bad, right?
It hurts.
This one hurts too?
Yeah.
Okay. Just like that, okay?
Okay.
So your pelvis is not going anywhere, but what I'm going to do is actually I'm going to adjust this joint, okay?
Okay.
The joint's semi-fused into there, okay,
Okay.
so it'll feel a little different. Just relax here a little bit. I'm going to give that a push forward. Okay, good. Okay. So if you look at the bone over here, this is the bone we're talking about. So you can see it's actually kind of fused.
Yeah.
It's kind of fused into there, but you see there's actually a little joint into there too. I don't know if you can tell if you notice you're standing differently, but there's less sway back happening into there. That's usually what happens when you adjust over here.
Mm-hmm.
So it will alleviate the pressure that we're feeling all the way through there. So this is clear. Even the top is clear. Good. Settling. I know that was your biggest
Well,
problem.
it's good. It definitely feels looser over here. You know, this is, again, I mean, this is something that's been plaguing me for a long time, but I do feel looser in here on this side a lot.
Good. The readings are better. Go ahead and tilt your head up. Let me know if that it's even better all the way
It is.
to the top.
It does feel better doing this already.